Hi Kaz, thanks for coming here today and for sharing a bit of your story with us. You were diagnosed with MS back in '95, and how has it influenced your life?
Hi Lisa. Well, to be honest, it seems like a long time ago, but it's been quite motivational to help me to campaign for MS, to help people understand about it. I do a lot of work with international charities, UK charities, to help people manage and to live as a normal life as possible with MS. So for me, you know, it's been a big part of my life per se, affecting the work that I do as an editor at the BMJ and also as a community specialist practitioner. So I have lots of kind of experience that I've gathered.
So you have had treatment all the way through?
Yes, I was pretty quick to request treatment. So I was allowed to start an MS treatment from 2 years after diagnosis. And then I went on as time progressed and technology, medical technology and research and evidence helped, a new treatment which is intravenous once a month. And that's sometimes a little bit difficult because of cannulation and finding the right vein to actually put the treatment through, which can be quite painful sometimes.
The pain, is that what is your primary concern, or is that what?
I think that's the hardest part of my infusion, to be honest. It's great to see my nurses, it's great to see fellow MS patients, but sometimes it's a bit painful and I end up with lots of bruises through the cannulation process because my veins aren't as good as they used to be.
So the long-term treatment has had an impact on your physiology, or so it has become more difficult over time? Do you feel that?
Yes, I think so. It is very difficult sometimes. You just can't account for it. I can't understand where my veins have gone. You know, it's just a very bad day. And sometimes, you know, I just wish they could find it quicker. You know, when you've had a needle put in 8 or 9 times, it really hurts. And,
yeah, that doesn't sound like a good experience. So, you know, we have developed the IVI, which is a vein finder working on the infrared light.
So how does that work? How does it work?
It's a small handheld device. It works on sending in near infrared light. Right. And that light is then reflected up in a camera. It's called trans illumination. Oh. And that way you can, on a little screen on the device, see where the veins are placed, and you can see up to 10 millimeters down.
Well, I suppose if your arms are swollen, if you've got a problem with drainage in the limbs or something, that must really help for things like that too, does it?
Actually, it was how the idea came about in the first place. I was doing a shift in a hospital here in the UK, and I was the nurse on duty, and I just couldn't put in the cannula, and I had the junior doctor coming and trying to do it, and she definitely wasn't happy and with it either, couldn't do it. So we called the registrar, and he came in and said, "How on earth do you expect me to do it? I haven't put in cannulas for a very long time." So we had to try A&E and the ICU, and but it all took an awful long time. So poor patient.
If you just want to get that in as soon as possible.
So and that was an edematous patient, and that was what caused the problem. So but we know now that the device can definitely do that job.
Fantastic.
Yeah. We can use it, or you can use it everywhere in where cannulation takes place. So it's both in primary care and secondary care.
Because that sometimes as a clinician, I've had patients crying because they just can't face the pain of having another attempt at trying to get a needle in, and that happens quite often as well on the MS unit when people are having problems. You know, it's very upsetting and distressing for both the patient and the family, you know. And
for the cannulator, for the nurses as well. Yeah. It's often like when you put in the cannula first, if you don't get it in first time, then the probability that you will get it in second time, simply because you go, this is difficult, and I didn't succeed first time, the probability really goes down.
Pressure's on, isn't it?
Oh, yeah, it just blocks the brain, and so it all becomes more difficult. Should I show you how the device works?
Yeah, please.
Yeah, I have one here.
take my bracelet off so you've got my arm and lift that up.
You can see it's a very small, handy device really, and there's only one button on off, so it's just very easy. So I'll just start showing you the veins where you can see them yourself, so you know that it's true what I'm telling you, that it's you can see them easily here on the screen.
Oh yeah.
And you can see there is a central line that shows you, and you line that up with the piece of vein where you want to put in the cannula. There's a little indication line here in front of the device. So let us follow it all the way up here, and we can just find some good pieces so you can be reassured that the vein is there.
Well, absolutely.
So
I feel
see?
much more happier knowing that I've got the veins and you can access them. Less attempts at cannulation. Much more reassuring.
It's also good for the person cannulating. It's just helps you to feel more certain that you are in the right place and that you will actually get the cannula in.
Giving you that confidence before you inflict pain on a patient is always good, isn't it?
Yes, it is. It helps. Having a second go is never an easy task.
And also as well, it shows that you tried. Yeah. Right.
So we can put the cannula in.
And this is just on my arm and my hands, is it?
Yes, it's the device is designed for peripheral cannulation only. It's the indication area.
Great.
Good. Well, this is what it does. I'm happy you like it.
Yes, I want one.
So now you have seen the device and you have heard a bit about it. And what is your take on it?
I'm really excited. I think this is, progress for patients, progress for administration of treatment, actually making people feel more comfortable about having their treatment in hospital. And the thrust as well with primary care and delivery of medication at home, as you just mentioned, is really, really what the patients want, because we know there's less risk of infection. Yeah. It saves you going into a hospital. And that's what they're looking at for even MS patients with their infusions. Yeah. So as much equipment, because you can't just phone a consultant when you're in your house, can you really, to come and do that? So this equipment would be fantastic to have available for, community specialist practitioners that are working out in, in people's homes. So where is this equipment available? Where can you buy it, or is it in the NHS?
We sell the IVI on a global level, so we sell through a global distributor network. And in the UK, we sell to the NHS, but also to private organizations. The easiest way is really to look at our website or contact our team. So you will get much more information there. They will be happy to help. Thanks a lot for coming and for sharing your views with us, Kaz, today. And I hope we will get a unit in your MS unit very soon.
So do I. Thank you.